Let's begin with a moment of centering. Place one hand on your chest and one hand on your belly. Take a natural breath and exhale slowly. One more time. This mini session follows a simple logic: brief, release, contact, breath. Let's start with the neck and shoulders. Bring your fingers to the upper trapezius area where the neck meets the shoulder. Look for a point that feels a little tighter or more sensitive. When you find it, apply gentle or medium pressure, always manageable, and hold for about 10 to 15 seconds. Breathe slowly, then switch to the other side and do the same. This is the trigger point step: short, targeted, and without forcing. Now let's add the regulating Psychopoint. Place your fingertips at the side base of the neck or on the collarbone area, wherever the contact feels more calming. Here, the pressure is lighter. Keep the contact for a few seconds, breathing slowly, first on one side and then on the other. If you want, at the end, place your hands on your shoulders and take a slow exhale, letting some of the weight drop. Now let's move to the chest and breathing area. For the trigger point step, work on the upper outer chest near the shoulder in a soft area. Avoid the center of the sternum in this phase. Look for a sensitive but tolerable point and hold gentle pressure for about 10 to 15 seconds. Breathe calmly. Then switch to the other side and repeat. There's no need for intensity here. We're only looking for a short, useful release. Now bring the work to a central Psychopoint. Place one hand or two fingers in the center of the chest on the sternum with a light but steady contact. Stay here for about 10 to 20 seconds. Breathe naturally and let the exhale become a little slower. If you want, you can think of creating a little more space in the chest without forcing the breath. This step helps a lot with integrating the mechanical release into a sense of calm. Now, let's move down to the lower back and pelvis area. For the trigger point step, place your hands on the sides of the low back, above the pelvis and away from the spine. Look for a slightly tight point in the side lumbar area. When you find it, hold manageable pressure for about 10 to 20 seconds. Then switch to the other side. Remember, do not press on the spine. We work on the sides calmly. Now, let's add the integrating Psychopoint. Place one palm on the sacrum in the low center of the back above the tailbone. Or place your fingers on the iliac crest at the side of the pelvis if that feels more comfortable. Here the contact is steady and reassuring, not strong. Stay for a few seconds, breathing slowly. Then place your hands on the hips and make a very small pelvic sway. Just a micro movement, only to help the area let go a little more. Pause and take a slow exhale. To close, place one hand on your chest and one hand on your belly, or one hand on the chest and one on the sacrum if that feels comfortable. Take 2 calm breaths. Inhale normally and exhale slowly. Take a moment to notice how the body feels now. We do not need a perfect release. We're simply looking for a little more space, a little less load, and a more stable feeling.